That's all I can say. Luis is a dental assistant. Wants to talk about Ebola. Yeah, that's folks that would see it. Sue's in Missouri, medical technologist. That's all the equipment. Steve's in Mass, staff nurse at hospital. Sarah's in Texas, friend works for hospital. So we'll go just in order. Sue in Missouri, thanks for calling. Do you have any information for us?
First of all, I just want to say thank you, Alex, and your team. You're doing a great job. I just wish that I could get more people to listen. The thought that they're pulling the protective equipment, not letting people get the protective equipment. My idea about that is, okay, what's the bottom line? Usually, what's the bottom line? It's the dollar. Okay, what do they have out there in the wings that they want to give to everybody? Okay, so if they take the protective equipment away from the medical workers, what's their next line of defense?
By the way, he mentions the Hospital Corporation of America, which is the biggest hospital chain, and my dad's even done work with them, and as a medical consultant, and he said they're taking their gear away. So it's, quote, all equal. No, it's so they don't create a panic. Well, that's criminal to take the gear away. I mean, that's like taking cops' guns away. This is insane.
I want the people to say, give me the vaccine. So if the medical workers take the vaccine, then the rest of the people are going to think the vaccine's okay to take. I think they're doing it because they want people, they're going to make the nurses and the doctors take the damn vaccine.
Oh, that's it. Just like with flu. They take
right. They're taking their equipment away, so now we know we have no protection when we go to a patient's room, or we have no protection. I work in the laboratory, so we have no protection when we work in the lab. So I think they're taking it away because the next thing the nurses will have to do is what? Give me the vaccine.
Very well said. Thank you, Sue. We'll see if we can get any intel from Steve in Mass, staff nurse at a hospital. Steve, do you have any information on this?
Hi, can you hear me, Alex?
Yes, sir.
Hi, Alex. I've been a registered nurse for about 7 years. My wife's also a nurse here in Massachusetts. And if this thing gets here, I mean, it's going to be a nightmare. You know, you have people waiting 12 hours in the emergency room piled on top of each other before they can even see a doctor. You know, that's plenty of time for the Ebola to spread or, jump patients to patients or patients to nurses.
That's what they say is the waiting room is the most dangerous place in America right now.
Yes, and there's maybe 3 negative pressure rooms, maybe in each emergency room. And what the first caller said about the flu shot, what I would encourage all healthcare workers to do is refuse it. Then they'll make you wear a mask, and it'll probably be safer than taking the flu vaccine anyway.
Do you have any information on what this doctor said earlier and what the medical doctors I've talked to are saying?
I do know that they have started training in 1 out of the 7 hospitals for Ebola. But it was merely a 15-minute in-service where they put a mask on and some gown. No protective equipment for the eyes. Like someone said the other week, that the N95 isn't the appropriate mask for Ebola, that you need something bigger like the N100. And I encourage all healthcare workers to buy it for themselves and use it at work.
Exactly. Thank you so much. Bobby's a New York City firefighter, and that's in the New York Post and the New York Times. They've been told, do not use the word Ebola over your radios, so that's evidence of the pre-preparation for cover-up. What's your information, Bobby? Thanks for calling.
Hey, Alex, how you doing, man? Long-time listener, first-time caller.
Welcome.
Be honest with you, I work in the Bronx. I haven't really heard anything about that. Maybe the dispatches have gotten that information.
Sure.
Because we get very limited information at the firehouse,
sure,
so to speak. But I mean, other than that, we haven't heard any information about that.
Sure. Well, we just put the New York Post up on screen. What's your take on all this?
Well, I could tell you at the firehouse level, we barely have hardly any information about Ebola. I mean, they give us these baseline suits, which basically are just for like projectile vomit. Like we very often we do CPR and such. But as far as Ebola goes, no, we're not equipped at all. There's no question we're not equipped.
What do you think of what Dr. James Lorenzi was saying earlier?
Honestly, I missed most of the interview, but I'm sure it's par for the course of what he was saying. I mean,
well, he was naming the hospital where they have people that look like they're dying of Ebola being disappeared by the feds, and he's talked to other doctors, and they say it's going on in other areas, and I know a major doctor in Texas saying the same thing.
Yeah, I mean, we're walking into stuff where, like, we don't even know what we're getting involved to. Like, we get a ticket at the firehouse, which is the the call. Someone calls 911, and we get a ticket at the firehouse, and we barely even know what we're getting into. They have this system implemented. It's called UCT, Unified Call Taker. It's like basic information. We don't even know what we're getting into.
Yeah, I've read that a lot of these centralized Homeland Security code systems now are not allowing real communication because it dumbs down the communication and takes the local control away. Never a good idea in my view. Thank you, Bobby. Be safe up there. Remember the deadly dust and the firefighters, and they said it was safe to breathe when their internal documents said it was deadly. Luis, Jeff, Joe, Sarah, your calls are all coming up straight ahead, and you can all email us at whistleblowers@infowars.com. Stay with us. We've got Luis, a dental assistant that has info. Jeff in Indiana is a firefighter. I want to get to everybody. We have Harry Dent coming on, but we'll get to you as well. Let's go. Let's move quickly through these calls. Sarah in Texas, tell us your information. Thank you.
Hi, Alex. Can you hear me?
Yes, I can.
Okay. Sorry, I'm nervous. I've never been on the radio before.
No, thank you for calling. Go ahead.
Okay, so I have a friend who works at a very big hospital in like northern Dallas, west. Sorry, I don't really want to give out the information because I'm not supposed to talk about it. But
well, listen, if you're not the actual person, it's okay. Just tell us what we need to know. We need to be scared of this Ebola getting out of hand. If you don't actually work there, there's not much they can do. Just tell us what they told you, please.
Basically, this happened maybe about 3 or 4 weeks ago in this hospital that somebody came in there with Ebola-like symptoms, but basically what it boiled down to is that they were stated to have malaria. And everything that's been going on that you've been covering about everybody else supposedly having malaria over Ebola it's uncanny.
That's what the major Texas City doctor told me. I want to give out the info, and I'm sworn to shut up. And then the other fellow who confirmed his identity up in Missouri, that's what they're being told. And the doctors are all, malaria doesn't make you bleed out of your eyeballs in your rear end. Malaria makes you get the chills and shrivel up and lose weight. I mean, this is incredible. So that's what they told you, was that they thought something was going on?
Yes, and they thought that was weird. Also what everybody else has been saying about the doctors losing their protective gear and stuff. Well, nobody ever talks about the people that have to go in and clean up after these patients, like in the ER, or you know what I mean, like.
Sure. The janitorial service with one Ebola patient in Dallas, they had bloody bandages and stuff, quote, piled to the ceiling. God bless you. Thank you for the call. Joe in Texas, who's a medical worker, listening on KDAV 1590 AM. Go ahead. Welcome to the airwaves.
Yes, I will try to make this as brief as possible. However, I'm not sure if I can. The point I wanted to make, though, is Big Pharmacy cannot do a double-blind study on an Ebola treatment. So they're working in conjunction with the CDC to spread this as wide as possible before true panic instills the country, and then they can actually test their treatments. It's all the dollar signs with the government and Big Pharmacy.
Well, that's for sure that they stand to gain from it, but they must think we're dumb if this gets out of hand and then they let it happen. I mean, they just must think they're above the law and totally invincible. Folks are going to be mad when kids are dead. I'm telling you, I've had enough of this.
Trying to downplay it as much as possible so that people will continue with their normal lives and be carriers and spread it so they can actually do a true study on a treatment.
And where are you specifically? I mean, I know the station you're calling from, but where are you?
I am currently in Lubbock, Texas.
And what are the other medical workers you talk to? I mean, do they agree with you, or what's their take?
They are terrified that the CDC is kind of blowing this off in the country. They're taking it seriously in Africa, but they're not protecting our own citizens because they want to do the government's bidding.
They want to bring this country down and make a bunch of money. Yeah.
Yeah. Yes.
I am so sick of it. Well, God bless you. Thank you for the call. Corey in Wisconsin, a police officer.